Hey everyone, we are going to be working on the nerves in this dissection. So I tried a little bit of a different way to do this first dissection. So this first part we're going to be doing the brachial plexus. And the brachial plexus is right up here in the arm. And the area that we're really going to be working on is the axilla region, which is kind of right in the armpit of this rabbit. So we're going to be looking at 5 different nerves. So I tested this out a little bit first before I wanted to show you guys. So what you want to do is find this pectoralis major muscle, which is this muscle right here that kind of covers that region. And we want to reflect it back towards the middle of the animal, so towards the medial side of the animal. And then I want to find my latissimus dorsi, which is this muscle right here underneath the armpit, and I want to reflect it laterally. So by doing that, I can already see that I have nerves, a nerve bundle right here in the arm. And also what you're looking at is the brachial artery right here as well. That's that big red artery right here. So the nerves are going to also run right along with that. And at this point, I'm also going to basically stop using my scalpel because these nerves are incredibly easy to cut and they kind of disappear, which then makes it really hard to tell which nerve you're actually looking at. So we have 5 branches in this brachial plexus, and what these nerves are doing, we have cutaneous sensation, muscular sensation, and also motor movement, all in the arm. So now I'm going to basically take my probe and take my tweezers, and I'm just going to start cleaning up some of this tissue so that I can find those nerves. Be very, very gentle when you are working in this part of the arm. Like I said, it's really easy to kind of break one of these nerves. And how we identify nerves is really by, we can see where they're coming from and where they're going. So if you were to cut a nerve, and we lose that sense of where it's coming from or where it's going to, it's really difficult to tell which one it is. So I'm starting to get more nerves uncovered here. Like I said, this is that brachial artery, and then right next to that artery, I'm going to see if I can pull this nerve up, separate these. Some of these fatty tissue. Okay, so here's my first nerve. So this is what those nerves look like. Is that white tissue. And this is our ulnar nerve. Ulnar, like we're going to the elbow. So this nerve I can tell is the ulnar because it's going deep into this elbow. And this ulnar nerve innervates within the muscles in the wrist and also into the hand. So if any of you have ever hit your funny bone, that's actually what you're hitting, is you're hitting this ulnar nerve. So then if I go up a little bit higher, I can find my next nerve. And this is called the radial nerve. And I can tell this is the radial because it's coming out of the same place as the ulnar, going deep into the triceps brachii up here. And this really affects extensor muscles. So when we talk about muscles here in a few weeks and we talk about the ability to extend, without this nerve, or if there's nerve damage, we wouldn't be able to extend the arm or extend your fingers. And the next one I'm going to show you guys is I go back to my ulnar nerve, and I have a nerve that comes off of the ulnar nerve called the median. And this nerve is right, it comes off of the median and goes about the same place. So it goes into the arm as well. So here I have the ulnar, and this median is branching. So the ulnar is right here, and that median is going to lay right next to it, not the artery. And because that branches off of the median, off of the ulnar, sorry, and then it follows down into the arm as well. So now to find back some more. Okay, there's my axillary. So I'm just going to cut away some tissue right here. Okay, so the next one I'm going to show you guys, this one's a little bit more difficult to find, but you're going to have to kind of pull aside the ulnar and the radian. We're going to dig underneath, and what we're going to find is this axillary. Right here, the bottom of my tweezers. And the axillary goes deep into the deltoid. That's this muscle up here on top of the shoulder, and that's our abductor. That goes into an abductor muscle. So the deltoid is an abductor muscle. Okay. Musculocutaneous. And then also, if you look, if you can dig deep enough, there's the axillary, and then right underneath of that is the subscapular. So the subscapular goes deep and comes around and attaches at the bottom of the scapula and innervates in those muscles. And we have one more to find for you guys. I have to dig for this one. The last one that we're going to find is the suprascapular. And the suprascapular is going to be up higher. We'll pull back some more of this muscle. Oh, sorry, actually we have two more to find now that I'm here. Okay, so we have the ulnar is this big one, and this one's very, very easy to cut, but this is called the musculocutaneous. It's this little muscle right here, and it actually, and it looks like I probably cut one, goes into the belly of the bicep and the brachialis muscle. So it actually goes into this muscle twice. There's two branches of it, but this is the top branch, is the musculocutaneous. Once again, this one is very, very easy to cut, so be super careful. And then the last one that I want to find is right in here where kind of all this muscle is. Because this one, suprascapular, means it goes to the top of the scapula. So again, what I'm doing is basically cutting this pectoralis major muscle back and trying to pull it back away from the nerves. Okay. Now my suprascapular is going to be right here. Clean up this tissue. Oops. Okay, so my last muscle, last nerve, suprascapular. So this one goes into the shoulder up high. So we have the brachial plexus kind of all down in here, and then this suprascapular is going to be a lot higher. So I'm going to go over these nerves one last time, just as a review for you guys. Okay, this is our ulnar. It goes deep into the elbow, and then right off of that, there's another branch called the median, and it follows and also goes into the elbow, but not quite as deep. And then we have the musculocutaneous. It's this tiny little nerve up here that goes into the bicep. And then underneath the ulnar is we have the radial. This one goes deep into the triceps brachii, goes deep into the arm, and actually controls movement even down in our fingers. And then if we go below that, I have the axillary and the subscapular. And then up higher, we have the suprascapular. And also while I'm up here, I want to show you guys the vagus nerve. So this nerve is going to run right next to the carotid. So find your carotid artery. And this nerve is going to run right next to it. So there's the vagus nerve. And the vagus nerve controls involuntary system, so it's going to control, it actually is the only one of the cranial nerves that leaves the head, and it goes down into your heart and into the digestive system, so it controls a lot of heart rate and functions of the digestive system as well. So the vagus nerve is up here right next to the carotid. And then lastly, I'm going to show you a couple in the leg of the rabbit. So I'm going to flip him around. And the first one I'm going to show you hopefully is going to be fairly easy to find, hopefully. So this one that I want to find is the femoral. So I can see that the femoral artery is running right through the leg here. So what I want to do is take my probe. I don't typically want to use my scalpel for this because you'll probably cut it. So I just really want to kind of get under this tissue and see if I can pull it back a little bit to find the nerve. Okay. And actually what I'm pulling back is a muscle right here. And we'll talk about that. It's called the gracilis. And we'll talk about that when we get into muscles once again in a few weeks. So I have exposed also this vein that's right here. And so my femoral nerve is running right next to that vein. So I have, if you guys can remember VAN, so we have vein, artery, nerve. All of those are the femoral nerve, femoral vein, and femoral artery. And then lastly, what I want to show you is we have a couple here on the back side. I'm going to have you cut in between the biceps femoris muscle and, which is this big guy, and the semitendinosus. So you can tell that there is the separation between these two muscles right here in the back. I can have my biceps femoris, tendinosus running right there. So I want to cut in between these two muscles. I'm also going to tell you guys that because you only have one leg left, we need to preserve these muscles the best that we can. So you can cut this biceps femoris, this big muscle right here. You can reflect it backwards, but take it as a whole piece. So you can start cutting of the back of the biceps femoris and cut all the way up to that stifle joint, and you should be able to kind of curve this muscle back. What I want to do is I want to peel it backwards, peel it back. And that is going to expose the sciatic nerve. Okay, so here is the sciatic nerve, this big white nerve right here. And then the sciatic nerve actually branches. So this top branch is called the common peroneal, and this bottom branch that goes into the bottom half of the leg is the tibial nerve. So this whole thing is the sciatic, but when it branches, you have the common peroneal on top. The bottom branch is the tibial nerve. And that tibial nerve goes all the way down into the bottom half of the leg, and it controls the muscles in the lower leg and also in the foot. So one last thing to mention about where we cut this muscle and pulled it back. It can happen that when you're giving an intramuscular shot, if you go in between these two muscles, you can hit the sciatic nerve and cause sciatic nerve damage and cause paralysis throughout the bottom half of that leg. All right, everyone, that is it for the nerves. If you have any questions, please come to lab with questions. These nerves can be pretty difficult to find, so don't be afraid to ask myself or any of the TAs to help find the nerves. We also will have this rabbit laying out so that you are able to see the nerves on this rabbit and also how to cut into the rabbit so that you can find the nerves as well. I'll see you guys in lab. Good luck on your pre-lab quiz.